A high-velocity thrust for a left-on-right adjustment can be performed as a Chicago adjustment, but one can also perform a prone, stomach-down manipulation. The very first thing I do is to lock the right axis by carefully pulling the leg over toward the rightmost side. I stand on the patient's right side precisely whenever the patient has this left-on-right adjustment. The patient turns his head to the left and places his right hand over his head, like this, in this position, exactly. There you go. And with his left hand, he positions himself as if he is about to perform an arm stretch, like this again, as I noted before. What I would like is that this be moved further back, even in order to achieve a better contact with it. And during this contact, I actually press down against it. That is to say, the patient first moves it back into my hand, and then I perform what resembles a ventral pressure in order to gently, gradually, slightly urge it to shift in this direction. Because the leg is positioned here, the axis becomes securely locked. I then carefully locate the exact point at which it seems to be locked here. And then I will request the patient in just a moment to lift their body. So to actually perform a proper push-up and also include the rotation. He can do that by turning his head to the left, which means over his left shoulder, and then looking steadily at me. Very few people can now lift themselves up in this way. Therefore, we help them by grabbing here on the shoulder as they rise. So now I'm asking you to perform a push-up. There you go. I am holding here down low. You turn your head and look up at me. Take a deep breath, and as you begin to relax. And then relax, relax, relax. Then I press downward firmly, and the downward pressure comes down onto the bench. And this downward action should be, in short, a quick and precise downward press on this side. And it is only the side that moves because the shaft is completely locked, and the way he slowly turns his own body. Thus, a high-velocity thrust from left to the right.